lot of questions about supplies coming in from the Strategic National Stockpile, so I want to address that again today. This week, we've been receiving our third shipment from the stockpile. We're still awaiting one final truck to arrive to complete that shipment. We expect that truck to arrive tonight. We have requested 500,000 of each of the following items from the national stockpile: N95 masks, procedure masks, gowns, gloves, face shields, and coveralls. I'll repeat the numbers that I provided 2 days ago. In the first two shipments, we received 38% of our N95 masks we requested, 91% of the procedure masks, 32% of gloves, 14% of gowns, 16% of face shields, and less than 1% of the coveralls. We'll provide an update to these numbers once the last part of that third shipment has been completely inventoried. We've already pushed out much of that third shipment to hospitals and medical providers. Our logistics and sourcing teams continue to find and buy additional personal protective equipment. Our orders so far are close to $100 million, but we have received very little of that. We're continuing to recruit, register, and screen disaster medical volunteers, including retired doctors, nurses, and other medical professionals. Nearly 1,900 people have registered online, and more than 700 have been vetted and are ready to work. These are medical professionals who can be assigned to hospitals and other medical facilities as needed to support medical surge. That's when hospitals open up additional beds after all the regular beds are filled. They can also be used to fill in for employees who might become sick. If you're a retired or former medical professional who would like to volunteer, you can register online at terms.ncem.org. Again, that's terms.ncem.org. I want to remind all North Carolinians to stay at home and to observe the social distancing guidelines. Please refrain from calling to report those who you don't think are following the rules. Call centers at the state and local levels, including 211 and 911, are receiving far too many calls from people wanting to report where social distancing is not being observed. Please stay at home, follow the guidelines, and encourage others in your community to follow them as well. Be kind and supportive to others. If we all do our best to stay home and maintain social distance, these calls won't be necessary. We also need to keep our 911 lines open for true emergencies. 211 is for people who need information or help with resources like food, utilities, and other human needs. For daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. Again, COVID-NC 898-211, and you'll receive regular text updates. About 60,000 people are already receiving text. Many organizations are working hard to make sure people stay fed during the pandemic. Our state school systems are operating more than 1,100 feeding sites and serving more than 500,000 meals a day to kids. Food banks are seeing an increased demand and need for donations. This can be money or canned shelf-stable foods. To donate money online or to find a food bank near you, visit feedingthecarolinas.org. Again, feedingthecarolinas.org. A visit to a food bank to get or give food is not considered a violation of the stay-at-home order. And while you're staying at home, today, as the Secretary said, is a great day to participate in the 2020 census. It's Census Day. It only takes about 10 minutes to complete the online form at my2020census.gov. We also received some good news from FEMA yesterday for some Hurricane Florence victims. For about 90 families who are still living in FEMA travel trailers or manufactured homes after Hurricane Florence, they will not be required to start paying rent this month as that was originally scheduled. Due to the pandemic, FEMA has granted a 90-day waiver on those rent payments. Thank you for your support of the State Emergency Response Team. Your personal actions to stay home, stay distanced, and stop the spread will help save lives. With your help, we'll all get through this together. One team, one mission, one family.
Thanks, Director Sprayberry. We'll now turn over for your questions.
Gary Robertson with Associated Press. I had a question for Mike. He's done a lot of procurement, I'm sure, over the years, getting ready for hurricanes or during hurricanes. I'm sure this is something that is far and above what he has done in the past. Could you just talk about the struggles and the challenges that his agency, the the emergency operations team has had in just acquiring these necessary supplies?
Thank you for that question, Gary. As you know, there's international, national, statewide, and local competition to get all of these medical supplies and equipment to respond adequately to the COVID-19 pandemic. We have had a difficult time finding vendors that can source our request. We're trying to make sure that the folks that are taking care of the folks in hospitals are getting those first. We've got a priority list. But having said that, we're still not getting enough. We're not even getting enough from the Strategic National Stockpile. But I can tell you that we are very persistent and we are relentless in seeking out resources. We anticipate that we're going to be getting some of those larger shipments, hopefully in the next couple of weeks. Again, we did get a good shipment from our SNS. It still wasn't what we wanted, but we'll continue to work hard and source all of those medical supplies and equipment that we so desperately need. Next few days that we might be able to start seeing some production lines starting that can produce gowns that will meet FDA requirements. We also know of some folks in Charlotte and some folks here in Raleigh that have shifted their production lines over to N95 respirators, and we've been working with our partners at our correction enterprise to begin to get things like disinfectant. So we're beginning to see a gradual shift of production lines in manufacturing, and we're working with our partners at the Department of Health and Human Services and other state agencies to really get everybody working on this together, because as you might imagine, here at Emergency Management, we don't have a whole lot of folks that are really were experts in manufacturing, but we have gradually gathered together some folks, and we're making some good progress. A gradual shift of production lines in manufacturing, and we're working with our partners at the Department of Health and Human Services and other state agencies to really get everybody working on this together, because as you might imagine, here at Emergency Management, don't have a whole lot of folks that are really were experts in manufacturing, but we have gradually gathered together some folks, and we're making some good progress.
Thanks for that question about masks. What I would say first and foremost, you've been hearing about supply issues, and we want to make sure that we are getting that protective equipment for our healthcare workers first and foremost, right? They're on the front lines treating sick folks with COVID-19, and we want to be protecting them. And as we said, the supply lines are tight here, and so all masks really need to be going to our healthcare workers, our first responders, those that are working in our higher risk settings. Then as we think out to the future, when supply lines are better, I think we need to think about what masks can really help us do. I think they may be one element to add to the things we already know are tried and true things that work to stop the spread of the virus. Things we can do right now, like washing our hands. So when someone wears a mask, it is actually them protecting the world from them. It actually prevents you from having your germs get out into the world, which can be a good thing, but you have to couple that with washing your hands if you want to protect yourself. So we're never going to get away from this, our new normal of washing our hands, using disinfectant, wiping down surfaces. So that's going to be with us for quite some time. Right now, like washing our hands. So when someone wears a mask, it is actually them protecting the world from them. It actually prevents you from having your germs germs get out into the world, which can be a good thing. But you have to couple that with washing your hands if you want to protect yourself. So we're never going to get away from this, our new normal of washing our hands, using disinfectant, wiping down surfaces. So that's going to be with us for quite some time.
To slow the spread among them, and can the state open other types of shelters for them right now? Would that even help? Thank you.
Yes, thanks, Andrea, for that question. And it is very much top of mind here, thinking about those in our communities who have unstable housing. So we are definitely working here in the state to come up with various types of housing plans, and then working with FEMA and other federal partners to get the funding and approvals needed to make that happen. We know there are a lot of community-based organizations and others who have already been doing this work. We have a terrific team for that question. That frankly has learned the hard way through some tough hurricanes about the importance of housing stability through times of crisis. So our teams are working hard on this issue. It's not easy. Housing is a hard issue in the best of times. And so we're working hard to make sure that we can find settings for folks to recover if they do have COVID-19 and ways to protect themselves. We know there are a lot of community-based organizations and others who are already been doing this work. We have a terrific team that frankly has learned the hard way through some tough hurricanes about the importance of housing stability through times of crisis. So our teams are working hard on this issue. It's not easy. Housing is a hard issue in the best of times. And so we're working hard to make sure that we can find settings for folks to recover if they do have COVID-19 and ways to protect themselves. So thanks for the question. I'll start, and then Director Sprayberry may want to add more, but great question. Right now, we're just wanting to understand who might be available. And then as we work on our medical capacity planning, we're going to have to be pretty flexible. We're going to want to move folks where they're most needed, obviously, where there are places where we might need to have those with the right skills match up to where the need is. And that's this big overall state planning effort that we're doing right now. We know that some of our clinicians may need some amount of training. They may have been trained to, and it's been quite some time since they've done inpatient hospital medicine. They're used to working in the outpatient setting. We want to make sure we're thinking about all of those things as well. And then I know Director Sprayberry's team is thinking about how do we move people around the state. Obviously, we'd like to do it as close to their home as possible, but we know we might need to move people around the state if that's what our needs are at the time. Director Sprayberry, anything to add?
Yes, ma'am. So I think that, first of all, with medical volunteers, they're being well vetted, and then
our needs are at the time. Director Sprayberry, anything to add?
Yes, ma'am. So I think that, first of all, with medical volunteers, they're being well vetted, and then they're being placed what we would call into staging and ready to deploy
my anticipation and our
when we need
planning
them.
factor for this
But
is that
really what I'm going to be
we would
doing is
anticipate
depending on
that
my technical
we would
partners,
integrate
DHHS, to let me know
volunteers
where they're
into
needed.
already
And my
established
anticipation and our
hospitals
planning
and
factor
other,
for this is that
places
we
of
would
medical
anticipate
care
that
so that they wouldn't have to
we
worry
would
about
integrate
going to a place
these
by themselves.
volunteers
They'd be
into
right there, and they would
already
be integrated
established
into a team.
hospitals
So
and
we're
other
very excited and proud
places
that we
of
have so
medical
many
care,
volunteers,
so that they
and I
wouldn't have
think
to
that,
worry about going to a place by
that would be
themselves.
the
They'd
way
be
we would
right
implement
there,
it.
and
We
they
would
would be
integrate
integrated
them
into a
in with
team. So
already
we're
established
very excited
healthcare
and proud that we have so
organizations
many
throughout the state on an
volunteers,
as-needed
and I think
basis.
that would be the way we would implement it. We would integrate them in
So
with
please
already
put yourself
established
on mute after you
healthcare
ask your
organizations
question.
throughout
Thanks
the
so much.
state on an as-needed basis.
To please put yourself on mute after you ask your question. Thanks so much. You there? You're breaking up a bit. Oop.
Yes, this is David.
There,
Ivey
you're
with
breaking up a
Spectrum
bit.
News. I'm in Fayetteville right now, and later this evening, a curfew is going to go into effect for the city. What I'd ask,
Yes, this is David Ivey with Spectrum News.
What do you think
I'm
about
in
that
Fayetteville
measure,
right
and is
now,
that something that
and
other
later this evening, a curfew is going to go into effect for the city. What I'd ask probably Secretary Cohen
What do you think
Again,
about
I'm going to
that
ask
measure?
folks to
And is
make
that
sure to put
something that
themselves on
other
mute while others are asking
municipalities in the-
questions. But I think the question was about curfews, and
Throughout the
is
state
that
at
something
some
that
point.
we are looking at? Again, I'm going to ask folks to make sure to
So
put
what I would
themselves
say
on
is
mute
we
while
are
others are
all
asking
looking at efforts
questions.
that are
But
going
I
to
think
slow
the
the
question was
spread
about
of this virus.
curfews, and
Slowing
is
the
that
spread of
something
this
that we are
virus
looking
is
at
going to save lives.
for the state?
As you know, the
So
governor's
what I would say
order
is
to stay
we
at
are
home
all
just
looking
went
at
into
efforts
effect
that
on
are going
Monday
to slow the
evening.
spread of this
We
virus.
want to make sure that
Slowing
folks
the
are
spread of
fully
this
complying
virus
with this,
is going to save
this
lives.
order. We fully
As you know, the
respect
governor's
and
order to
support
stay at
local
home just went
communities
into
going
effect on
further,
Monday
than
evening.
the governor's
We want to
order
make
in
sure
order
that
to
folks
keep,
are fully
their
complying with
communities,
this order.
doing as much
We
social
fully
distancing
respect
as
and
possible. So we
support
support
local
those
communities going
activities,
further
and we will continue to
than
look
the
at
governor's
options to see if we
order
need to
in
do
order to
further
keep
social
their
distancing. We'll continue to
communities
look at our case
doing as
counts
much
and our
social distancing as
hospitalizations and our strain
possible.
on our
So we
medical
support those
system,
activities.
and learn
And
from
we will
other
continue
places
to look
around
at
the country
options to
to
see if we need to
understand
do
what is
further
working
social
and
distancing. We'll
what
continue
might,
to look at our
need to be
case
changed as
counts
we
and
go
our
forward here. But
hospitalizations
right
and our
now,
strain on
we're
our
focused
medical
on
system,
implementing the governor's
and
executive
learn
order
from other places around the country
Monday,
to
which is a
understand what is
stay-at-home
working
order.
and
Again,
what might
public schools
need to
closed,
be
mass
changed as we
gatherings
go forward
closed,
here. But right
restaurants and
now,
bars
we're
only
focused on
open
implementing
for
the
takeout
governor's
only.
executive order from
Folks should be not
Monday,
having
which is a
any gatherings
stay-at-home
larger than
order.
10,
Again,
and really
public
focusing
schools
on
closed, mass
staying
gatherings
at home,
closed,
unless you're going to the
restaurants
grocery
and bars
store,
only open
seeking
for
medical
takeout
care,
only.
picking up your
Folks should be
medications,
not
folks
having
need
any
to be
gatherings larger
staying
than
at
10,
home,
and really
as much
focusing
as
on
possible.
staying
Obviously, if you
at
work in an
home. Unless you're going to the
essential
grocery
business,
store,
like healthcare,
seeking medical care,
or
picking
our
up your
utilities or our
medications.
grocers,
Folks
we
need
know
to
you have to
be
go out
staying
to
at
work as
home
well. In those
as much as
circumstances,
possible.
we want
Obviously,
folks
if you
to be
work in
as
an essential
careful as
business,
possible.
like healthcare,
Continue to do those,
or
those
our
important things
utilities
about
or our
washing your hands.
grocers,
It
we know
works.
you
The
have
data
to
tells
go
us
out
washing
to
your
work as
hands,
well. In
washing
those
down surfaces,
circumstances, we
that
want folks
works.
to be
So
as careful
thank you
as
for
possible.
all you are doing out
Continue
there
to do
comply
those
with this. It
those
does
important
save
things
lives.
about washing your hands. It works. The data tells us washing your hands, washing down surfaces, that works. So thank you for all you
Hi,
are
this
doing
is
out
Jason
there to
Boone
comply
with
with
North
this. It
Carolina
does
Public
save
Radio.
lives.
I know one of the choke points to getting more testing done was not having enough of the PPE. Hi, this is Jason DeBruin with North Carolina Public Radio. I know one of the choke points to getting more testing done was not having enough of the PPE. I wonder with some of that coming in, if that will free up some more testing capacity
So the question,
in the near
Jason,
future,
yes,
and
testing
also with some
continues
other
to be a
private
very
tests coming
important
online,
component
if you
of
might
us fighting
see some ramping up
COVID-19.
in
We want to
COVID-19
prioritize
testing here in the
for
near
those
future.
folks who are
So the
in
question, Jason,
hospitals,
yes,
in
testing
long-term care
continues to be a
facilities,
very
and in
important
other
component
places
of
where
us fighting
outbreaks and the spread
COVID-19.
of the virus
We
can
want to
be,
prioritize testing
rapid.
for those
So
folks who
we are
are
definitely
in hospitals,
targeting our testing
in long-term
there,
care
again, trying to
facilities, and in
prioritize
other
both our
places
resources
where
and our testing
outbreaks
capacity.
and the spread of the
I
virus
do
can
think
be
testing and ramping up
rapid.
our testing
So
capacity
we are definitely
continues to be an
targeting our
important
testing
focus
there,
for
again,
us.
trying
We
to
need
prioritize
partners at
both
the
our
federal
resources
government
and
the
our
private
testing
sector,
capacity.
to
I do think
continue to work
testing
with us
and
on
ramping up our
that.
testing
We do
capacity
see multiple
continues
new
to be an
modalities
important
for
focus
testing that
for
have
us.
come out, some
We need
more
partners
rapid
at the federal
testing. I think
government
all
and
of
the
that is
private
positive
sector
news in the right direction.
to continue
We
to
wanna
work
make
with
sure
us
these
on
tests
that.
are
We
though
do see
also
multiple new
high-quality
modalities
tests
for
that can
testing
actually
that have come
detect
out, some more
COVID-19.
rapid
We
testing.
don't
I think
want
all of
tests
that is
that
positive
miss
news in the
the
right direction.
COVID-19, and
We want to
we
make
have
sure
people
these
who
tests
think they
are though
negative but
also
actually have
high quality
COVID-19.
tests
So
that can
we wanna
actually
make sure the
detect
tests are
COVID-19.
working well.
We don't want tests that
and
miss
they have good
the
throughput.
COVID-19
Some of
and
these
we
new,
have
faster
people who think
methods,
they're
they only do
negative but
one at a
actually have
time. So that
COVID-19.
might be
So
good
want to
for
make sure the
smaller,
tests are
places
working
or
well,
doctors' offices,
and
but
that they
our
have good
bigger labs do
throughput. Some of
hundreds
these
of
new
samples,
faster
at a
methods,
time, though it may
they only
take a
do
number
one
of
at a
hours to
time.
run
So
them.
that might be
So I think
good
it's
for
gonna take a
smaller
whole range
places
of
or
techniques,
doctors' offices.
that we'll need
But
to ramp
our
up,
bigger
over
labs
this
do
period of
hundreds of
time
samples
in order
at a
to,
time,
again,
though
do
it
the
may take a
testing that
number
we
of
want.
hours to run
I'm
them.
hoping that
So I
we
think it's
have
going to
more
take a whole
success
range
at
of
different
techniques
ways of
that we'll
collecting
need to
samples
ramp
that
up
use over this period of time in order to, again, do the testing that we want. I'm hoping that we have more success at different ways of collecting samples that uses less of the protective equipment that we know is in short supply. So I know our scientists are working hard on this, and we want to support as much of that work as possible, and work with our federal partners and our private lab partners, our academic partners as they ramp up.
With the Daily Record and done. going back to what with the question on the CDC's possibility of having people wear face masks. What about the effectiveness of homemade masks? For people, I've seen it; it's being used elsewhere. What's the effectiveness of a homemade mask, and is that a viable possibility?
Thanks for the question. Again, if you can mute your phone. So the question was about the viability of a homemade mask. So as you look at the data around masks, it's mixed. What I would say is masks are always going to need to be used. Thanks for the question. Again, if you can mute your phone. So the question was about the viability of a homemade mask. So as you look at the data around masks, it's mixed. What I would say is masks are always going to need to be used in combination with the tried and true measures of washing your hands. And then there are different materials that masks can come in. There are certain materials that have natural antiviral, antibacterial kinds of properties versus other kinds of materials that may be more porous. So homemade masks, again, are going to be variable in terms of their ability to block your droplets from getting into the world. Again, masks are protecting the world from you. It's not really protecting you from the world. But I think there is a place for masks once we make sure that all of our healthcare workers have the masks that they need so that they are protected. So that's certainly Director Sprayberry and my focus right now is that we're scouring the world to make sure we have the supplies for our frontline healthcare workers and our first-line responders for all the work they're doing. And then let me just add, thanks for end this press conference and thanking them for all the work that they're doing out there. They're the heroes on the front lines here. So thank you. Know that we're working for you to protect you all the time. Thanks for all that you're doing. And again, thanks for the time today. And again, check out ncdhhs.gov/coronavirus for the latest information. Text COVID-NC to 898-211 for more information. And again, it's Census Day. Be counted. Thank you. Stay well.